Hi, hello, welcome back. So today we will be seeing about cardiac valve procedure 33361233478. This is a topic which is coming under CPT cardiovascular. So we have given a detailed explanation in this video. So please do watch full video. So let us divide the CPT code for cardiac valve 33361233478. These codes are used to describe procedure related to the repair and replacement of heart valves which are critical for maintaining proper blood flow through the heart. So introduction, these codes cover a variety of procedure related to the heart valves including minimally invasive and open surgical techniques for repairing or replacing the aortic, mitral, pulmonary and tricuspid valves. Definition: heart valve structure that ensure one-way blood flow through the heart chambers. Aortic valve present between left ventricle and aorta. Mitral valve present between left atrium and left ventricle. Pulmonary valve present between right ventricle and pulmonary artery. Tricuspid valve present between right atrium and right ventricle. Example for this is TAVR for a patient with severe aortic stenosis who is at high risk for open heart surgery. For this, we are coding 33361 transcatheter aortic valve replacement with percutaneous access. So, replacement of aortic valve using a catheter, we will be assigning this code. Second example, TAVR performed on a patient using femoral artery for assist. For this, we are giving 33362 replacement of aortic valve via an open surgical approach through the femoral artery. Next example, TAVR performed on a patient using the iliac artery for access. For this, we are coding 33363 TAVR with open iliac artery approach. So, description here is replacement of the aortic valve via an open surgical approach through the iliac artery. Next example, TAVR performed on a patient using direct aortic access. For this, we are coding 33364 TAVR with open aortic approach. Description is replacement of the aortic valve via an open surgical approach directly through the aorta. Next example, TAVR performed on a patient using the subclavian artery for access. For this, we are giving 33365 TAVR with an open subclavian or axillary approach. Description: replacement of aortic valve via an open surgical approach through the subclavian or axial artery. Next, TAVR performed using an alternative access route not specified in other codes. For this, we are giving 33366 TAVR with other than percutaneous or open approaches. Next, the 33340 valvotomy mitral valve open heart approach, surgical incision into the mitral valve to relieve stenosis using an open heart approach. Next example is 33471 valvotomy mitral valve closed heart approach. So here the closed mitral valvotomy performed without cardiopulmonary bypass. For this, we will be assigning 33471. Next one is next is 33473 valvotomy aortic valve closed heart approach. For this, description is surgical incision into the aortic valve to relieve stenosis using a closed heart approach. Example, closed aortic valvotomy performed without cardiopulmonary bypass. Next, 33475 valvotomy pulmonary valve closed heart approach. Here, description is surgical incision into the pulmonary valve to relieve stenosis using a closed heart approach. Next is 33476 valvotomy tricuspid valve open heart approach. Description: surgical incision into the tricuspid valve to relieve stenosis using an open heart approach. Example: open tricuspid valvotomy for tricuspid valve stenosis. Next is 33477 valvotomy tricuspid valve closed heart approach. that is surgical incision into the tricuspid valve to relieve stenosis using a closed heart approach. Example, closed tricuspid valvotomy performed without cardiopulmonary bypass. Next is 33478 transcatheter mitral valve repair. Here the description is repair of the mitral valve using a transcatheter approach. Example, mitral clip procedure for mitral valve regurgitation. Tips: you have to go through the documentation very clearly, like you have to know which valve is involved, what type of approach is used, whether it is open, percutaneous or other, any prosthetic catheter is used, modifier is being implemented, please do assign the modifier correctly. That's all about this procedure, and you can have a view on the playlist which we have added for CPT procedure. You can have a view on it, and before that, if you haven't subscribed my channel, please do subscribe, and if you find it useful, please do share it with your friends also. Thank you so much for watching my video. Take care. Bye bye.